Today we'll be seeing about COVID-19 and also its vaccines and what is the current status of the development of COVID-19 vaccines. Why? Because this is an emerging trend in the development of pharmacology and also its use in the beneficial use for the well-being of the mankind. This chapter is very important. We'll be seeing about the recent drugs and also what are the vaccines and against which these vaccines are being directed for its use, and we will be seeing in detail about the structure. And everyone should know about this COVID-19, and because it is important, because there is no eradication. So till the eradication, we have to know about the current status of the COVID-19 too. Now coming to introduction. Coronavirus, that is COVID-19, it was recognized in the late 2019 and it was first reported in Wuhan in China. So the name COVID-19 came because it was recognized in the late 2019. And also the analysis of the viral genome, that is the COVID-19 virus, has revealed that the new coronavirus is phylogenetically very related to the acute respiratory syndrome, that is SARS virus, that is severe acute respiratory syndrome coronavirus. That is, so the name SARS-CoV came because it is phylogenetically very related to that severe acute respiratory syndrome, which is the causative agent which was responsible for the outbreak which occurred in 2 decades ago, that is in 2002, and 50% close to MERS-CoV causative agent for the outbreak in the 2012. And the name new coronavirus has been named SARS-CoV-2 by International Committee on Taxonomy of Viruses and other virologists. And in the March 11th, 2020, WHO declared it as an worldwide pandemic because this is the increasing in the mortality and the severity and also the rapid rampant increase in the number of cases because the WHO declared it as an worldwide pandemic. And we know that it has resulted in the death of many people and it has caused very high economic burden because of the social distancing and also because of the lockdown measures which are taken by each government, because it has caused very severe economic burden. To avoid this severe economic burden and also to prevent its outbreaks and relapses, we are in search of effective vaccines and also effective drugs. And now coming to the etiological agents which is responsible for this COVID disease, it is a new coronavirus of the family belonging to Coronaviridae, and the subfamilies are Litovirinae and Orthocoronavirinae. And also Orthocoronavirinae, it includes alpha coronavirus, beta coronavirus, gamma and delta coronavirus. And the beta coronavirus, these are the most pathogenic to humans, are SARS-CoV and the Middle East Respiratory Syndrome coronavirus, that is MERS-CoV. What is the full form of MERS-CoV? Middle East Respiratory Syndrome coronavirus. And the new SARS-CoV-2 is a non-segmented positive single stranded. This is important. It may be asked for MCQ. What is the genetic material present in the coronavirus? That is single-stranded RNA. It is a single-stranded RNA virus, and specifically of the beta coronavirus genus. And also this SARS-CoV-2, that is severe acute respiratory syndrome coronavirus COVID-2, can survive in vitro, that is in the body, for 48 hours and in the dry environment and up to 5 days under 20 degrees Celsius and 40 to 50% humidity. In this point, it is important that it belongs to the family Coronaviridae, and also what is the genetic material present in the coronavirus, that is single-stranded RNA. Now coming to the general structure of a coronavirus, it consists of mainly 4 proteins, and we will be seeing the structure in the next slide. And it consists of N protein. What is N protein? It is a nucleocapsid protein. And what is S protein? It is a spike protein. This nucleocapsid protein, it forms an helical capsid that includes the viral genome. This capsid, it also includes the viral genome. And also what is S protein or spike protein? It forms the lipid envelope that surrounds the virus in the form of a crown. Corona means crown. And also the S protein of SARS-CoV-2 has high affinity for ACE2 receptors. This is the receptor where this virus comes and bind. What is ACE2 receptors? Full form angiotensin converting enzyme 2 receptors, to which the virus comes and bind to the host cells, and it is mediated by transmembrane serine protease 2, that is TMSP2, transmembrane serine protease 2, and it also consists of envelope protein and also membrane protein. Now coming to the structure. This is the structure of coronavirus, and this is the spike protein which helps in attachment, and also this is the M protein. Here is also M protein. This is also M protein, and surrounding this remaining rest is envelope protein. If this is M protein, this is envelope protein, and also this is nucleocapsid protein, N protein. N protein is nucleocapsid protein. It envelopes the genome material also too. Now coming to N protein, it is bound to the RNA and it constitutes in the makeup of nucleocapsid. Nucleocapsid is along with the nuclear material and the coating membrane. And S protein, spike protein. S protein, what is its function? It is critical for binding of the host cell receptors to facilitate entry into the host cells. And also what is envelope protein? E protein. It interacts with the M protein to form the viral envelope. And also what is M protein? M protein is nothing but it is the central organizer of COVID assembly that is, and also determine the shape of the envelope. After the formation of the genetic material, that is multiplication after the entry into the host cell, and also the structure of the assembly of the structural proteins or molecules, there is formation of the new viral genomes or viral particles or virions, and also this M protein is responsible as, and also it plays a role as central organizer of COVID assembly and also determines the shape of the viral envelope. Now coming to routes of transmission of coronavirus. Droplets and fomites during the close contact with infected subjects in case of coughing and sneezing. So it's mainly spread through droplet infection. Remember it mainly spreads through droplet infection, and also aerosol, that is produced from aerosol generating devices, could lead to the infection spread, particularly in the hospitals. Aerosol spread is common in the case of hospital, and droplet spread is common in community spread. And airborne spread of COVID-19 has not proven to be the major route of infection transmission based on the available route. Another suspected route of infection is fecal-oral route, according to the general literature. For example, these bats, these act as a reservoir of coronavirus. This is the pathogenesis and how it is spread. For example, if you take these are the bats. These are the reservoir of host cells of the coronavirus. From this, through the cross-species transmission, that is, the bats are one species, and the pigs, wild bird, chicken, cat, bat, dog, and also seal, horse, camel, cattle, goat, sheep, and these are the another species. This is nothing but cross-species transmission is nothing but transmission of virus from this species, that is bat, to this another species, either through this species or through livestock, wild animals, that is animals living in the wet markets. Either the virus may spread from this species to this, or this species to this species, that is horse, camel, etc. So this virus will get entry into these wild animals, and from them through the zoonotic transmission. What is zoonotic transmission? Infection spreading from animals to the humans is known as zoonotic transmission. Through the zoonotic transmission, it is spreading to the man. Here also, through the zoonotic transmission, it is spreading to the man, and through the community contact, it is coming done through mass gatherings. Through mass gatherings, it is spreading to the one individual to the other individuals, and also to the hospitalized individuals. To the hospitalized individuals, through this person who is hospitalized, this infection is spreading from hospitalized individual to the healthcare workers, nurses, doctors, and also other laboratory faculty or other any ward boys who are working in the hospitals. This hospitalized individual is spreading infection to the either to the medical or medical staff or healthcare workers, or through the neighboring other patients are also getting infected with these individuals. This is the mode of transmission, how these coronavirus from bats, it comes to the animals, and to the animals to the humans and community, and to the individuals in the hospitals or patients in the hospitals, to the healthcare workers, to the other patients. This is the brief diagram showing the transmission of the virus. Now coming to the pathophysiology. Here in pathophysiology, as I mentioned earlier, the word corona means crown and refers to the appearance that corona gets from the coronavirus, gets from the spike protein sticking out of them. And these spike proteins are important to the biology of the virus. And the spike protein is a part of a virus that attaches to the human host cell, that is ACE receptors. I told you what is the role of S protein or spike protein helps in attachment to the receptors. That is which receptors? ACE2 receptors. What are ACE2 receptors? Angiotensin converting enzyme 2 receptors that are present on the type 2 alveolar cells. Where are type 2 alveolar cells present? They are present in the lungs. What are they concerned with? They are concerned with the production of surfactant. What is the role of surfactant? Decreasing the surface tension. So this is mainly targeting the type 2 alveolar cells. And also what are the receptor getting targeted? ACE2 receptors. And some antibodies can protect you from SARS-CoV-2 by targeting the spike proteins. And because of the importance of this scientific part of the virus, scientists who sequence the virus for research constantly monitor gene mutations are causing them changes to the spike protein to the process called of genomic surveillance. Nothing to the continuous surveillance, whether there is occurrence of any mutation or whether there are any changes in the spike proteins. We can do these changes or we can monitor these changes through the process of genomic surveillance. Now, this is the process how these are coming into the entry into the host cells. And this is, if you take this as an type 2 alveolar cell, and these are the receptors, ACE2 receptors and TMPR SS2 receptors, and this is the structure of the COVID virus, and this is the spike proteins. These spike proteins, they come and bind to the receptors, and through these receptors and also binding to the entry to the ACE2 receptors, the virus is coming and entry. This is the first step, viral entry into the host cell. And in the host cell, there is release of viral genome. And this release viral genome, that is the positive strand of this viral genome, it undergoes translation, that is modification in the protein structures, and there is modification in the proteins. And these proteins, after this translation process with the help of ribosomes. What is the main function of ribosomes? They are concerned with the protein synthesis. So translation also is, ribosomes are also helping in the process of translation. And after translation, that is protein synthesis, because of the proteolysis, that is degradation of proteins with the help of replicate transcriptase complex, there is RNA replication. RNA replication is nothing but RNA multiplication. This is one strand, and also this is another strand, that is subgenomic RNA strand. This is the negative sense strand. This is the positive sense strand earlier before the process of translation. After the RNA replication, we are getting a negative sense strand from the positive sense strand. And after this formation of this negative and positive sense strands, these genomic and subgenomic RNA, that is positive strands, they undergo transcription, that is they undergo rapid multiplication or division, and after the multiplication, number of copies are formed, and with the help of these proteins, and the proteins are also synthesized. N proteins, S proteins, M and envelope and accessory materials are also synthesized, and these undergo packing, that is viral protein translation with the help of endoplasmic Golgi intermediate complex, and this RNA genome plus these viral assembly, viral proteins which have been, that is these are the components of capsid materials, or the outer envelope, or some of the outer materials enveloping the nucleic capsid. All these materials are formed, and also the genomic materials are formed. Both these combine to form a nucleic capsid assembly and viral assembly, and ultimately a final shape, or the final virion type of particle is formed. And these budding or dividing virion particles, they are released to the outer environment, and because of this, one single virus is forming number of virus particles, and they are infecting number of individuals. Hope you understood that. Nothing but there is entry of SARS-CoV virus into the cells with the help of binding to the S receptors and the ACE2 receptors. This is important MCQ. And also this process, there is nothing but entry into the host cells, and also the viral genome translation, proteolysis, and RNA replication, and synthesis of the nucleic core material or capsid materials, that is N, S, M, and E, and accessory proteins. And the viral genome, along with these proteins, they form a new virion particles and are released into the exterior. Hope you remember this one. And this point, at this juncture, you have to remember ACE2 receptors, which is the receptor to which these S proteins come and bind, is ACE2 receptor. This is important in the overall diagram. And with this, and in this process, the number of viral particles are released into the environment, or budding virions are released into the environment. Now this is an central illustration of interaction of renin-angiotensin RAS system with that of SARS-CoV-2. RAS system mainly, this is the angiotensin 1, which is converted into angiotensin 2, and also it is converted into angiotensin 1 and 2, 1 to 7. And also this is the ACE2 enzyme or receptors to which the SARS-CoV-2 comes and bind. Because of these AT1 receptors that is present in the adrenal medulla, it is concerned with aldosterone synthesis, and also it acts in the posterior pituitary antidiuretic hormone. And because of this there is increased hypertrophy, increased fibrosis, and increased inflammation, oxidative stress, and apoptosis. And also this is concerned with anti-inflammatory, anti-proliferative, and anti-fibrotic, and anti-apoptotic, and vasodilatation. And because of the release of antidiuretic hormone, there is increased water reabsorption, and also in aldosterone, it is concerned with sodium and chloride reabsorption, potassium secretion, and water reabsorption. This is nothing but there is interaction, there is alteration in the RAS system with the COVID-19. Remember this one. This is not important at your level, but there is alteration of the renin-angiotensin system when it interacts with the COVID-19. This is not that much important for you. This is important, and this is also in this diagram. ACE2 receptor is only important for you. Now, what are the symptoms occurring with this virus? The fever and headache are most common symptoms, and also chills like under malaise, etc. are common, and body pains are also common, and flu-like illness-like symptoms are also seen. And also there is accumulation of fluid in the pleural cavities, leading to the difficulty in the breathing. And this is the because of the alveolar edema. The fluid gets accumulates in the pleural spaces, and also fluid gets accumulated in the alveolar spaces, leading to difficulty in breathing. And through the ingestion, this virus enters into the lungs and in the alveolar cells. These are the changes occurring. And also in the circulation, that is in the heart, it leads to decreased blood pressure and also decreased perfusion, acute respiratory distress syndrome, and MOD or multi-organ failure or multi-organ dysfunction, and ultimately death. And these are the drugs which are targeting these cells. For example, if we take some antibodies, tocilizumab, we remember this tocilizumab. What is tocilizumab? IL-6 antagonist or IL-6 interleukin 6 against antibodies is known as tocilizumab and itolizumab. For example, all these are targeting the IL-6. You remember IL-6, tocilizumab, and also this is alveolar edema, and there is neutrophil. This is the capillary endothelial membrane, and also this is the alveolar cell. And this is where this what we have seen is in the alveolar cell, these are the ACE2 receptors. You remember these drugs, chloroquine and hydroquine, they are mainly targeting at this level. And also at the level of proteolysis, lopinavir and ritonavir are targeting. And at the level of translation and RNA replication, remdesivir is targeting. And this is the viral packaging and release. And also you remember this one, chloroquine and hydrochloroquine are concerned with the release, targeting at the site of release of the viral genome. And also these are at the level of proteolysis, lopinavir and ritonavir are targeting. And at the level of translation, remdesivir and favipiravir and avigan is target. These are the drugs they are targeting. This is the structure. These are the symptoms after the inhalation. There is the change. Because of these changes, there are some sensors or signals going to the hypothalamus, leading to the release of pyrogens and also resetting the hypothalamus temperature. That is, there is occurrence of fever and headache. Now coming to incubation period. What is incubation period? The time between occurrence of the infection and also the appearance of the symptoms. That is the time between occurrence of the infection and the presentation of the symptoms. It varies from one individual to other or one patient to another. For example, the incubation period of SARS-CoV-2 is between 2 to 14 days or 2 days to 2 weeks. And now coming to clinical features. Highly varied, mild to moderate symptoms. They include fever, cough, fatigue, and sputum production, dyspnea, sore throat, diarrhea, headache, and altered sensorium and taste. And altered smell, not sensorium, it is altered smell. Anosmia. This is the most common complaint. When there is isolated symptom of anosmia without having headache, fever, etc. And also there is hyperosmia following the COVID infection in many individuals. And also it can progress to severe pneumonia in older patients and those with underlying conditions. For example, these are the individuals who are at risk of developing this severe pneumonia. They are hypertensive patients, COPD patients, diabetes, and cardiovascular disease patients. And according to the symptoms and laboratory data, oxygen saturation, the COVID-19 case could be considered as mild, moderate, and severe pneumonia and ARDS syndrome. Mainly because we have clinically seen that oxygen saturation, SpO2 monitoring is very important in COVID-19. And also there is occurrence of DIC and also multi-organ dysfunction and cytokine storm leading to the overproduction of pro-inflammatory cytokines, leading to the further inflammation or further this release of the pro-inflammatory cytokines. They recruit the further inflammatory mediators to the site of inflammation or accumulation. That is, they further draw the lymphocytes and they cause further worsening of the disease. And these are the clinical features. You have to remember general symptomatic features, and that is fever, malaise, headache, etc., diarrhea, and also altered smell and taste, and also it can lead to severe pneumonia in older patients. And also based on how we are classifying these mild, moderate, and severe based on the oxygen saturation and also D-dimer test and various tests and other, according to the symptomatology and also the respiratory distress, etc. And these are the complications, that is disseminated intravascular coagulation and also multi-organ dysfunction or multi-organ failure and ultimately death. And also there is release of cytokines, that is cytokine storm. How we are going to diagnose this COVID-19 virus, that is COVID-19 infection. Mainly RT-PCR tests have been done and also blood tests, and there is in blood tests, that is D-dimer test, and also imaging techniques based on CT and MRI. CT was most commonly used, and based on the CT, we have classified this scoring as a CORAD score, given the score of CORADs 1, 2, etc., 2, 3, etc. And also there was a very scoring based on this CORAD score. We classified the severity of the patients also. And out of this, there was a score of about 25. Now coming to how we are going to manage these COVID-19 infections, and also mainly the prevention, that is we are going to prevent this COVID-19 virus by following these precautions, that is by social distancing, masks, sanitizer usage, and PPE kits. PPE kits were mainly used by the healthcare workers, and also masks were used by the common workers, common people, and also the sanitizer use to prevent or to avoid the fecal-oral route transmission. Also, treatment, largely supportive treatment only was given, that is maintain to treat the fever and also to treat any hypotension like conditions and to treat the respiratory difficulty. Symptomatic treatment was done, and general supportive measures were maintaining the vitals, and also maintain by oxygen therapy was mainly initiated and given, and also ventilation was given in the severe cases. And medications, most of these were off-label medications which were given during the period of COVID-19. None of them were FDA-approved medications, and also most of the drugs were tried but were ineffective. For example, hydroxychloroquine, that is actually an anti-malarial, but it was tried, but it was proved ineffective. There are no any studies. They were supporting that this hydroxychloroquine was effective in preventing the COVID-19 virus. There was no FDA-approved drug which was tried, which was used during the period of COVID-19. Now coming to the majority of the treatment options and strategies that were evaluated during the infection have been taken from our previous experiences in treating, because actually what we have said earlier, because this COVID-19 is phylogenetically, that is almost similar to that of SARS, and also 50% similar to that of Middle East respiratory syndrome, that is COVID-19, and other emerging viral infections. Because due to these previous experiences and the drugs which were tried against these viruses, we have just hit and run the drugs also against which this COVID-19 may respond. There was a hope that this COVID-19 may respond to that of the drugs which are used against that those earlier occurring viral diseases, and there was a hope. And also several therapeutic and preventive strategies, including the vaccines and immunotherapeutic and antiviral drugs, have been exploited against the previous COVID outbreaks, that is both SARS-CoV and MERS-CoV. Now coming to drugs approved by the Drug Control General of India for experimental and emergency use, they were mainly hydroxychloroquine, which is an anti-malarial drug, and also ivermectin. Ivermectin is used against, actually it is used against scabies, and also ascorbic acid, vitamin C. These are the most commonly used. Ivermectin 12 mg. Like that, every patient were prescribed as ivermectin or ivermectin, and also ascorbic acid or vitamin C were given. And also some antivirals like favipiravir. That is, favipiravir showed some beneficial effects according to my knowledge. Favipiravir showed some effective in some cases, and also remdesivir was also right. And what is remdesivir? Everyone knows, adenosine nucleotide analog, and mainly it acts by inhibiting RNA dependent RNA polymerase. And favipiravir, that is an guanine nucleotide analog. Mainly we are targeting the genetic material. We are inhibiting the replication of the genetic material of this COVID-19, thereby inhibiting the further budding or progression or dividing of the virions. And also some immunosuppressants and corticosteroids. These corticosteroids were excessively used. These were used without any prescription or without any need. Every individual who was tested positive in the swab test, they itself took this corticosteroid. But there are very late manifestations of this steroid use in COVID-19. There are now many cases have been reporting. Mainly, I have seen many cases recently presenting with hip or bone abnormalities. For example, osteonecrosis of the femur is being affected, and also many studies have said that these post-COVID individuals, they are presenting with many cardiac problems and etc. And also this convalescent plasma was also tried. That is convalescent plasma containing antibodies from the previously infected individuals were taken, and this convalescent plasma was used to treat the presently who ill COVID patients. And also anticoagulants were used in case of accepted DAC. That is, in DAC, enoxaparin was used, and also many antibiotics were used. There is no role of antibiotics against viral infections, but to prevent any secondary infections like secondary bacterial infections, mainly amoxiclav was amoxiclav and azithromycin and clarithromycin. These were used to prevent any secondary bacterial or secondary respiratory or upper respiratory tract infections, and persons with upper respiratory tract infections to avoid the spread into the lower respiratory tract. And these are the drugs which are approved by the Drug Control General of India, but not by the FDA. These are not FDA approved drugs. These are just tried because based on the previous experiences of this SARS-CoV and MERS-CoV virus. And now coming to immunotherapy, this tocilizumab was also used. I have mentioned this tocilizumab in anti-rheumatoid drug also, and this is an IL-6 receptor antagonist, and also this is an humanized receptor antibody that is active against IL-6, and in arthritis, that is rheumatoid arthritis, and cytokine strains, that is by reducing the mortality rates. And also baricitinib, that is an JAK kinase 1 or 2 selective kinase inhibitors used in the treatment of RA, treatment on severe cases of COVID-19 in preventing the progression to ARDS, that is acute respiratory distress syndrome. And also some monoclonal antibodies they received emergency use approval from US FDA for non-hospitalized patients, including satrovimab, and also bamlanivimab, and also atezolizumab, and imdevimab, and casirivimab. That is the region cover. These are the approved monoclonal antibodies for emergency use authorization. These are approved by the FDA because it is a very serious and very rampant progressing condition. So there are any studies or trials because any clinical trial to be commenced, it nearly takes some larger period of time. It takes nearly approximately 10 years for a study to get completed and also the drug to be released. But it is very rapidly rampant spreading disease. It was affecting the mortality. So many drugs were given emergency use authorization, and these are tried like hit and run drugs only. Immunotherapy, mainly immunotherapy, here we are talking about monoclonal antibodies. Now coming to COVID-19 vaccines. These are vaccines, and vaccines are the most effective strategy for preventing the infectious disease, and they are more cost effective than the treatment because the hospitalized stay, it may cause more economic burden than that of vaccines. These vaccines, mainly Covaxin and Covishield, that were supplied by the government of the India, they were supplied free of cost. And also these vaccines help in reducing the morbidity and also the mortality rate. And also in order to reduce this infection and mitigate the pandemic, population vaccination has been established as an safe and effective strategy to provide protection and reduce the spread of the disease. And this is the genetic sequence. This is not that much important for you. And now coming to the components needed for a vaccine design. For example, what do you mean by antigen? We define an antigen as an foreign substance, that is an foreign material that can induce a immune response within a body. And also what is an adjuvant? And also adjuvant is a stimulatory agent which is designed to boost up the host immune response towards a co-delivered antigen. And also nanoparticle or a nano carrier. And also this nanoparticle may be either viral or a non-viral and can be employed as a nanocarrier to encapsulate or present the antigen or a nucleic acid encoding the antigen. And these are nanoparticle or nanocarriers. In brief term, you remember, I will explain you very simplified manner. These nanoparticles and nanocarriers, they are very minute in size. These nanoparticles are this drug delivery concept because these are very important because they go and target the site. For example, if the virus is present in the alveolar cells, these nanoparticles, they go and target the drug. They go and target the virus which is present in the alveolar site, carrying the drug molecule which is active against the virus. They are nothing but these nanoparticles are carriers that carries the drug, and they carry the drug to the site where there is virus particles. For example, if the virus is present in the alveolar cells, they directly go and carry this drug to the alveolar cells where the virus is present. That is also known as targeted drug delivery system. That is, these nanoparticles are a component of targeted drug delivery system. I hope you understood this one. Now coming to this, these vaccines, they belong to 4 different groups based on their mode of action, and which includes mRNA based vaccine and also inactivated vaccine. That is, they do not contain any viable material. That is inactivated or dead something. And also non-replicating viral vector vaccine and peptide vaccine. And also the spike protein of coronavirus is an important target of vaccine development because it mediates the infection mechanism through the receptor bindings of the host cell. Where is this S protein going and binding? This S protein is going and binding to the ACE2 receptors. So this S protein is very important. This last line is not much that important. Now, if you see this diagram, for example, this is an inactivated viral vaccine. This inactivated viral vaccine, after this is broken down into various particles because this is broken down. This is the viral genome after entry. This is broken down into the viral particles, and because of this breakdown, it produces an antibody mediated immunity. And if you see this viral vector vaccine, this is an virus, and through the viral vector vaccine, this leads to the viral replication, and it leads in the viral replication. And this is an mRNA vaccine. This mRNA vaccine, it enters into the host cells and it is targeting the genetic material and finally leading to the top that this is the synthesis. And DNA vaccine and mRNA vaccine, they are both targeting this the genetic material, and they are leading to the further, they are affecting the multiplication. And also this protein subunit vaccine, they are mainly responsible, this protein subunit vaccine, and also this another vaccine, that is they are responsible for antibody mediated immunity. Both this antibody mediated immunity is important in the vaccine pathogenesis and vaccine effectiveness. Now coming to this DNA and RNA vaccine, how it is working. For example, if you take this is mRNA vaccine and DNA, these two, how they are going to work. This vaccine uses DNA or RNA molecules to teach the immune system to target the key viral proteins. And also, these advantages of this DNA and RNA vaccine are easy and quick to design. And live attenuated vaccine, this is a weakened version of actual virus. And also, it stimulates a robust and strong immune response without causing serious damage. And inactivated vaccine uses the whole virus after it has been killed or heat or chemicals. It is very safe to use because this virus is already dead and easily to make. And also subunit vaccine, this virus uses a piece of virus surface to focus your immune system onto a single target. And it focuses the immune response on the most important part of the virus for protection and cannot cause the infection. And this is the another And the disadvantages are of this DNA or RNA vaccines are never used before. There are no any licensed, and also existing examples are none. And the group testing in this approach is Moderna, that is RNA. Codagenics is the vaccine of live attenuated vaccine and may not be used for, may not be safe for those with the compromised immune system. And also existing examples of this live attenuated vaccines are MMR vaccines and chickenpox vaccine and Codagenics. And also this Sinovac and Sinopharm, this is not available in India. And Novavax and AdaptVax, it is about inactivated subunit vaccine examples. And these are the disadvantages and existing examples. And inactivated vaccine existing example is polio vaccine. And this is the chart you may refer here. This is not that much important. You just remember the names: DNA and RNA vaccine, and also live attenuated vaccines were tried. Inactivated vaccines were tried. Subunit vaccines were tried. Now coming to mRNA vaccines. These mRNA vaccines, these are rapidly developing technologies. These are very rapidly developing technologies to treat infectious diseases and also cancers. And the mRNA-based vaccines contains mRNAs encoding the antigens, which are translated at the cellular machinery by vaccination. And in contrast to this conventional, conventional vaccines, which are produced in a cell culture system, Moderna mRNA vaccine is designed in silico, which enables the rapid development and evaluation of this vaccine efficacy. This is the structure of the SARS-CoV-19 too. And from this structure, this mRNA is isolated. And this mRNA COVID vaccine, this is the name. That is, these are the names, Spikevax, etc. And these are more than 91% efficacy against COVID-19. Just you remember the name of this one name, Spikevax, you remember that one. This is not that much important at your level. Now, the first vaccine to gain full FDA, this is important, Pfizer vaccine. This is the first vaccine to gain full development. FDA approval was mRNA COVID-19 vaccine, Pfizer vaccine. And the second mRNA vaccine was Spikevax, Moderna, approved by the FDA in January 2022. And accidentally, each of these vaccine has emergency use authorization for children as young as 6 months. And also 2 bivalent vaccines for use as boosters were granted as emergency use authorization in August 2022 to enhance the coverage from Omicron, BA4 and BA5 subvariant. This slide is very important. This is the structure. This is the mRNA, and this slide is very important from the first slide. Moderna, that is Spikevax, Moderna, and Pfizer developed with the BioNTech in August 21, and in 2022 Spikevax, Moderna. This is the viral vector vaccines. They are created by using recombinant DNA technologies and also involve the use of live attenuated adenovirus that carries this genetic code for the SARS-CoV-2 virus. That also, this is the spike protein, S protein, and this is by using this recombinant technology, it carries the genetic code for against the spike protein. That is the spike protein. And also AstraZeneca is an example. Remember this name, AstraZeneca. AstraZeneca that carries the genetic code for the SARS-CoV S protein. S protein, this is the target. Viral protein, viral vector vaccines, and the viral vector live attenuated adenovirus is an adenoviral vector. Now coming to subunit vaccines. Subunit vaccines in which all are a part of the virus, that is spike protein S is expressed in the cell surface without introducing the viable part. Only this S protein is expressed into the cells without introducing these viable particles, that is genetic material. And these examples are Novavax. More than 90% efficacy against COVID-19 vaccine. And in general, subunit vaccines are advantageous over other types of vaccines, that they are highly safe, and also we are having very fewer side effects by inducing the immune system without introducing infectious viruses. And subunit vaccines, vaccine development studies have also reported that enhancement of T-cell immune response and generation of high titer neutralizing antibodies in vitro. Now coming to inactivated viral vaccines. These inactivated vaccines are easier to manufacture, scale up, and do not require ultra-cold supply chain. And it does not possess any risk to the immunocompromised patients, unlike the live vaccines. These inactivated vaccines have a limitation of protection in a short term and also weaker immune response, and a need for booster arises to reach long-term immunity. This is about the inactivated. Why multiple vaccines are prepared? A variety of COVID-19 vaccines have been developed around the world, and all of them, they share a common one thing, that is common point among them. All of them, they all stimulate the primary immune response, or the body can develop the memory B and T cells against the SARS-CoV-2 virus. And each COVID-19 vaccine has distinct advantages and disadvantages. But the development of different COVID-19 vaccines provides some redundancy and overlap. And in case a vaccine is unsafe in humans or fails to protect against COVID-19, the world has other COVID-19 vaccines that it can trial and produce. And vaccines authorized for emergency use. This is not important in this level, but remember this one. Covishield, this one is remembered. Dose is 0.52, dose for first dose 0.5 ml, second dose 0.5 ml, 2 to 8 degrees, Serum Institute of India, given through IM route, and also side effects are swelling, bursting, pain at the site of injection, rash, and also another one is Covaxin. This is important. Covaxin dose is 0.5 ml developed by Bharat Biotech IM, pain at the site of injection. Also another vaccine which is important at this level, at your level. These two are enough at your level. That is, remember Covaxin and Covishield. Covishield, same 0.5 ml, 0.5 ml, first and second dose, 2 to 8 degrees, Serum Institute of India, that is in Pune, and IM is the route of administration, and swelling, bruising, not bursting, that is bruising at the pain site is, and also a site of injection and rash. And also this Covaxin dose is 0.5 ml and second dose is 0.5 ml, 2 to 8. Same, both the doses are given at the 0.5 ml, and this is developed by the Covaxin is developed by Bharat Biotech IM, pain at the site of injection. And also these are the COVID vaccines in India. So I told this Covishield and Covaxin 2, and developed by Bharat Biotech, the whole virion inactivated. The whole virion is nothing but the entire genetic material and also the outer membrane is inactivated. Vaccine got approval for use in January 2022. It has a shelf life of about 12 months. It can be stored for a period of 12 months. And while 11 vaccines have been approved for emergency use, and this is not that much use. Sputnik V, remember Russia. This is important name. That is Sputnik V, Covishield, Covaxin. And these are the differences. How many doses are required and what is the efficacy and what are the common side effects between Covaxin, Covishield and Sputnik. And Sputnik, I told you, it is developed by Russia. And these are the 2 doses, Covaxin, Covishield 2 doses, 45 days apart. Sputnik V, 2 doses, 21 days apart. And this is the efficacy, 81 for Covaxin, 70 to 75 for Covishield, and 91% efficacy for Sputnik V. And what are the common side effects? These are the common side effects. And flu-like illness, and also because of this reason only they are given paracetamol tablet following injection, because the patient may develop mild aches. Because this is in vaccine we are giving the viruses only, either by we are killing the virus, that is inactivated virus, or we are giving the live attenuated virus by inserting the mRNA or DNA, mRNA or DNA. Like that we are inducing an immune response so that these antibodies could be produced against these vaccines, these vaccines, and further prevent the infection of the virus. And this is not that much important. And remember this one, other vaccines awaiting for emergency use authorization. Zycovid, which is being developed by India, it is an subunit. Covishield and Covaxin are inactivated vaccine. And Bio COVID-19, India and US subunit vaccine. And BBV 154 and HGC 0.019, India only, India US. Here the type is RNA vaccine, and BBV 154 developed by India, adenovirus vaccine. These are under preclinical trials only. This is not that important. And various factors affecting the vaccine effectiveness. Do all the individuals who are getting vaccinated develop COVID further, or they reduce the severity? What are the factors? For example, harsh factors like old age, immunity is very reduced, and previous infection, and also immune compromised states, and also genetic polymorphism, and also underlying health conditions. All these lead to vaccine. All these factors, they contribute how much efficacy or efficient the vaccine is in giving these individuals. And also compared to comparing the coming to demographic factors, and also the high levels of circulating virus in the environment, and also close proximity of the people living together, and also high levels of the vaccine uptake and high levels of the herd immunity. Herd immunity is nothing but community immunity. And if the herd immunity has reached a peak stage, there is we can blindly tell that we can get immune. We are immune against this disease, and we are not so bothered about it. And also vaccine assess factors, which vaccine was used, whether Covishield, Covaxin, Sputnik, etc. And also number of doses, whether the individual has taken 1 or 2 doses, and also timing between the doses. For example, the interval between the Covishield, that is 28 days, and for Covaxin it was 45 days. If the interval between the two vaccines is very short, or the interval between the two vaccines is very long, this also depends on the vaccine effectiveness. And cost verified decisions by the national vaccine bodies, and limited access to the vaccine. And now coming to the other factors like immune factors, high antibody titers actually in the person present in the body, and also the quality of the antibody neutralization, and also the T cells. All these factors, the demographic factors, host factors, and viral variant factors, and also the vaccine access factors and immune factors, they all contribute to the vaccine effectiveness. Whether they have these, for example, these colors, this pale blue color, this is contributed to the unknown effect on the vaccine efficacy. And also this, for example, this color, light red or crimson color, it has negative effect on vaccine efficacy. And also this light green color, it has positive effect on this. For example, these high antibody titers, they have positive effect on vaccine efficacy. And also the previous infection, it has positive effect on vaccine efficacy. And also the high levels of vaccine uptake, and also the high levels of herd immunity, they have positive effect on this vaccine efficacy. Now coming to the what are the side effects of the post-COVID vaccine. And now we have seen that most of the individuals after the vaccination, they are presenting with various conditions, and also either during the not any vaccine is 100% safe. Either the person may have any allergy or hypersensitivity to the vaccine, and also he may present with some fever, chills, and also persistent fever, and also he may have myalgia, and also some may develop thromboembolism and DVT in the later stage. There are common side effects of COVID-19 vaccine that affect both functions and ability to perform activities. Redness, pain, and swelling at the site of injection, body and muscle pain, dizziness, malaise, feeling ill, and also uneasy or discomfort, feeling fatigue, headache, fever, chills, and nausea, vomiting, diarrhea. And also, very rarely, some people may develop long-term side effects of the COVID-19 vaccine that present with thromboembolism and DVT are the long-term side effects. This anaphylaxis is sudden. Anaphylaxis is sudden, and also thromboembolism and DVT are long-term. Now, vaccine development. This is not important at your level. Now, coming to hurdles in the development of the vaccine, antibody-dependent enhancement, that is, the antibodies generated by the vaccination can promote viral infectivity, and also the higher mutation rate of the RNA viruses compared to that of the DNA viruses, resulting in the higher genetic diversity. And vaccine development itself is normally a very long process to ensure that vaccines are safe and effectively before they are used. And what are the strategies to overcome COVID-19 vaccine administration and stability? This is important. Molnupiravir, that is the antiviral pill. The pharmaceutical from Merck has recently announced the development of antiviral pill, that is Molnupiravir, which could force the virus to itself mutations and itself death. The virus to mutate itself and lead to death. And also it cuts hospitalization and death by 50% in mild to moderate COVID-19 virus. And Molnupiravir, it targets RNA-dependent RNA polymerase enzymes. And another pill, Paxlovid, was launched by Pfizer, and it is a combination of ritonavir and nirmatrelvir that inhibits both SARS-CoV-2 replication. And protease inhibitor antiviral therapy, it reduces hospitalization and death by 89%, making it more efficacious than Molnupiravir. And also, Pfizer is seeking EUA for Paxlovid. So you remember this. You remember here in this slide. You remember Molnupiravir, Paxlovid. Both are antiviral pills. You remember just antiviral pill, that is Molnupiravir and Paxlovid. These are recent advances, and also recent advances mix and match vaccines, and that is a mixing of mRNA, spike adjuvant, and adenoviral vaccines. We are mixing all the components, and these vaccines have turned to be highly effective, safe, and producing stronger immune responses and exceeding the performance of mRNA vaccine. And now coming to nasal vaccines are also being that is codagenics, and another we have seen about IM vaccines. There are nasal vaccines being developed, that is codagenics. Another adenoviral vector vaccine is under development, and this vaccine was found to be well tolerated, and it is simple and painless vaccine of administering the vaccine through nasal drops. And another live attenuating vaccine is developed by the Bharat Biotech, is currently under the trials. And to conclude, the COVID-19 vaccine has been in the market worldwide and already effective, useful to billions of people. And these COVID-19 vaccines are effectively safe, but emergence of new variants has led to decrease in their efficacy. And approval of the COVID-19 vaccines and vaccine acceptance among people are the major steps in combating SARS-CoV-2. With the rising new variants, strategies have been developed to fight against the upcoming variants, and including approval for antiviral pills and microneedle delivery systems. These are the another recent advances. Microneedle delivery system. This is about COVID-19, and what is important for you in this chapter, I will tell you from beginning. This is important. Mainly, this is the life cycle, that is how the virus is entered. SARS-CoV-2 binding to the AC2 receptors. This receptor is important, and these are the steps you should remember. And this is not that much important for you. And these are the enzymes. These are the drugs, mainly targeting. For example, I had told this entry is blocked by chloroquine and hydroxychloroquine, and the proteolysis is blocked by lopinavir and ritonavir, and translation is blocked by remdesivir, favipiravir, etc. And this is the alveolar cell, and these are the drugs at which the level at which they are acting, and these are the clinical features: fluid accumulation, difficulty in breathing, fever, headache, and also the circulatory. This is the important, and these are the IL-6 interleukins which are being produced, and also the drugs they are targeting this interleukin. This is important for you, and clinical features are important, and how do you make diagnosis is important, and prevention is important, and this is important. Which are the drugs that were tried by the DCGA? This is important slide. Hydrochloroquine, ivermectin, ascorbic acid, and antivirals like remdesivir, favipiravir, and immunosuppressants and corticosteroids were tried, and convalescent plasma was also tried, and anticoagulants, except in the case of expected DIC, that was enoxaparin was tried, and antibiotics, amoxicillin, clarithromycin was tried. This is important, and tocilizumab. This is very important. This drug is very important, and this is a previous NEET PG MCQ in 2021. Tocilizumab, where it is acting IL-6 receptor monoclonal antibody acting against IL-6 receptors. And these names are not that much important for you. Remember that tocilizumab is an immunotherapy. Now coming to COVID-19 vaccines. This one, in this you have to remember this one: mRNA-based vaccine, inactivated vaccine, non-replicating viral peptide vaccines, and which protein is being targeted? S protein is being targeted. S protein. This is S protein. The underlined highlight is S protein. And these are the differences. Just if you go through, you will understand. Mandiji explained everything here, and these are the examples. Spikevax is the name for mRNA vaccine, and this is important. This Spikevax, Moderna, and also Pfizer Biotech mRNA. This slide is important for you. And here Covishield, this one you remember, Covishield, and Covaxin. See, this slide is important. Covishield, Covaxin, and also Sputnik V. And these are the differences between Covaxin, Covishield, and Sputnik. And number of doses which you are giving, this is important. This may be asked in your Viva, or if a short note comes about recent advances in the COVID-19 or vaccines for COVID-19, you can write about COVID vaccines, Covishield and Covaxin, and also this is Sputnik vaccine. These are the recent developments. The viral various factors affecting the vaccine effectiveness. The side effects of post-COVID vaccine is also important. Just read these slides which I was mentioned, which is important only. Remaining, if you want to gain knowledge, you can read it. I didn't I kept everything because some people may have interest in reading everything. And for your exam point of view and from your MCQ point of view, just to go through these slides which I have mentioned, which are important. That is ACE2 receptors, spike proteins, and what are the different types of vaccines, mRNA, DNA, inactivated, subunit. Just and their examples, you remember, that is enough. And you remember about the Covishield and Covaxin thoroughly. What are the number of doses and what is the route of administration? What is the time gap between each dose, that is first dose and second dose? You read that one. And also in recent advances, you read about this one, antiviral pills. That is molnupiravir. That is important. This is enough for your, and also this nasal vaccine. These are the recent advances. We are in the stage of about IM vaccines, but there are some vaccines which are coming in the future as a nasal drug. That is important from here. Thank you.